So most of my audience probably realizes by now that the undocumented immigration US-Mexico border situation is definitely not a crisis. It's definitely not a national emergency. That doesn't mean national emergencies don't exist. What is an actual emergency is yet another one of these measles outbreaks, this one in Washington state, caused by parents choosing not to vaccinate their children. I recently told you 2 weeks ago about the anti-vaccine movement being listed as one of the top 10 global health threats in 2019 by the World Health Organization. This is a major, major problem in many parts of the world. We now have a mini measles outbreak in Washington state where 36 cases are reported so far, and the governor has declared a public health emergency in the state. Almost every single one of those 36 cases, 35 actually, are kids under 10, most of whom have not been vaccinated, plus one adult case. That makes up the 36. Now, you might say, well, are 36 cases really an emergency? It seems like a small number in a state that has a population of millions. Well, the reason it's an emergency, there's actually a couple reasons why it's an emergency. Number one, this is optional, and it's happening because parents are choosing not to vaccinate their kids. So there's the concern that I guess I would say, if non-vaccination grows in popularity, the spread can become exponentially greater because measles is highly contagious. It can kill small children. And again, all but one of the cases, as of a few hours ago, are kids under 10. And the spread has taken place in just about 10 days. You can catch measles by going into a room hours after someone with measles has left the room. So imagine the chaos that this can cause in public healthcare facilities, in schools, in community centers, in retail stores where people have been touching iPads and mobile phones or whatever else they go in to look at. Also, there's a question of what happens to also be taking place in Washington state. In Washington state, it's much easier to get these opt-out exemptions from vaccines for kids that are going to public schools. In a lot of these counties in Washington state, also in Oregon, it's a problem. The opt-out rate for vaccination is getting close to 10% in some places, 7.5% in some others. These are the non-medical exemptions, okay? Sometimes people can't get vaccines because of medical conditions. A number of different conditions, which I don't have to list today. That's not what I'm talking about here. And because of how herd immunity works and the reality that not everybody can get vaccinated, when your non-medical opt-out rate starts to get to 7, 8, 9, 10%, you are going to significantly exacerbate the spread of disease, period. Most of these cases could have been prevented. Not all, right? No vaccine is 100%. But the way the math works, this is an optional outbreak. And the real people who lose in these cases, Pat, are the kids. I mean, we have to realize the parents more than likely are vaccinated. They have made the decision not to vaccinate their children. Measles is far less deadly for adults than for kids. So this is an actual emergency. The US-Mexico border, not actually an emergency.
Yeah, whenever a child comes down with a serious disease, it's tragic, but this is even more tragic in some sense because it's totally preventable. We already have the medicine. We already have the discoveries. This doesn't have to happen. In the same way, it's kind of like gun violence, right? We know how to cut down on the number of mass shootings. We know that fewer guns means less crime, and yet we still have to deal with the problem because we just can't convince some people that we have the right way to approach it. It's the same here, and it's really unfortunate.
So what can we do? What are at least options for what could be done? Number one, it should be really difficult to get non-medical exemptions for vaccines if you want to put your kid in a public school. Okay, that's it. It needs to be much harder, and there are laws in a lot of states in the works. Some have already passed them, some are discussing them to make it much more difficult to get non-medically related exemptions from vaccination for children who are going to public school. If you're homeschooling, as unfortunately lots of anti-vaxxers do, fortunately or unfortunately, depending on your approach, do whatever you want, right? I don't know of a legal framework where the government would force vaccination, but as a requirement for public school attendance, it should not be easy to get a non-medical exemption. Other ideas that have been floated, and it's unclear whether these could really be made realities. Insurance companies could look at whether they are going to pay for treatment coming from non-medical vaccine exemptions, right? So if you chose not to vaccinate your kid for measles and there was no medically relevant reason to do that, could insurance companies consider limiting how much they are going to reimburse in those cases? Is that a door we would want to open? I don't know. I'm just telling you it's an option that's being discussed. I read one idea of looking at whether optional non-vaccination should be considered a type of neglect by state child services, although that's a very tough hill to climb, and there are probably some slippery slope questions there that are not unconcerning. But with everything that we're dealing with, climate change, our political system subjugated by corporate interests and wealthy people, media consolidation and takeover, immoral wealth inequality, we have parents causing a problem because they just don't want to vaccinate their kids. It's absolutely pathetic. And now we actually have a public health emergency in the state of Washington. Truly, truly disgusting. One of today's sponsors is privacy.com/Pakman, which is a free service that I myself use. Really useful in many different ways. Takes just a few seconds to link your debit card to privacy.com. Then you can create virtual credit cards that are linked directly to your bank account, and you use those virtual credit card numbers to buy things online, which protects your actual debit card so that it's not spread all over the internet. And one of the best things about it is how their mobile app and browser extensions for Chrome and Firefox make it really easy to use. Let's say, for example, that I'm signing up for a David Pakman Show membership. In the credit card number field, I already see the privacy.com icon. I just click it, choose which of my virtual credit cards I want to use, and the credit card number, expiration date, and security code are automatically entered. I can put in any zip code I want, and I'm done. And if you try to use my credit card number that you just saw on the screen, it doesn't matter, because I've already deleted that virtual card, and that's the beauty of privacy.com. There are a ton of advantages to using a free service like this. For example, you can sign up for as many free trials as you want, then just delete the virtual credit card you used and never worry about getting charged for it. It protects you from getting hacked. It protects you when companies are hacked, which happens all the time. It is all completely free. All you have to do is click the link under this video to get started. And for a limited time, they're giving everyone in our audience $5 towards your first purchase when you sign up using that link.